If you've just had or are about to have ACL reconstruction surgery, then this video is for you. I'm Dr. Donovan, a UK licensed doctor, and in this video, I'll be walking you through what to expect, how long recovery typically takes, what you can do to help yourself heal well as some important warning signs to look out for following the operation, which may indicate a potential complication. As ever, please remember that this video is for general education purposes only. It's not personalised medical advice, and if you've recently had surgery or you're worried about your recovery, please do speak to your own healthcare provider. So firstly, what happens right after ACL surgery? Well, most people actually go home on the same day as their operation. Typically, if everything has gone to plan, you'll wake up in recovery, you'll be given pain relief, and once you're safe to move, the physiotherapy and nursing team will help you stand and take your first steps using crutches. Now, before you leave hospital, your physiotherapist will show you how to walk safely, how to manage stairs if needed, and give you early exercises to start restoring movement and engaging the muscles around the knee. You might be given crutches and in some cases a knee brace for support, and your team will explain how long to use them for. Now, in a later video, I'm going to post a whole series of videos with general recovery exercises with a physiotherapy colleague of mine, so please do stay tuned for these. But in the meantime, please check out the description box of this video where you will find links to helpful resources on rehab exercises. But you should receive a personalised rehab plan from your physiotherapy team. If you haven't received one, please make sure that you ask for one. So what does recovery at home look like? Well, in the first few weeks following surgery, the goals are to manage pain and swelling, regain knee movement, start activating your quadriceps, which are the muscles at the front of the thigh, which help to provide stability to the knee joint, and to protect your new ligament. Early on, it's actually normal to use crutches, and your physiotherapist will tell you when it's safe to come off them. You'll also have regular physio appointments, typically for several months, and you'll do exercises at home to build strength, balance, and control in the knee joint. Now, this is absolutely essential for long-term success, and I can't stress this enough. Now, what other things can you do to help yourself? Well, some of the most helpful things are actually really simple, and consistency here really matters. And here are 6 really important self-help tips. Firstly, take the painkillers that you've been prescribed. Staying ahead of the pain helps you to move, and ultimately movement is going to be really important for that early rehab. Secondly, use ice wrapped in a tea towel for 15 to 20 minutes at a time to reduce swelling, especially in the first 72 hours following surgery. Thirdly, keep your leg elevated when resting. Fourthly, get up and walk short distances regularly. This helps circulation and reduces the risk of blood clots forming. Fifthly, avoid twisting, deep bending, kneeling, or sudden side-to-side movements early on. And finally, try to avoid placing a pillow under the knee for long periods. This can cause stiffness and actually make it harder to straighten your leg fully. Now, most people are actually able to return to work between 4 to 6 weeks, depending on the job. But if your work is physically demanding, you may need longer. Again, speak to your surgeon about what they recommend. And one more thing, don't drive until your surgical team have told you it is safe to do so. And make sure that you let your insurer know that you've had surgery. So typically, how long does recovery take from ACL surgery? Well, to be honest, this question is a tough question to answer because everyone is different. But in general, recovery from ACL surgery is a marathon and not a sprint. Generally, you'll usually be able to walk more comfortably within a few weeks and do most day-to-day activities after a couple of months. But returning to higher level sport, for example, so especially twisting or pivoting sports like football, netball, skiing, or rugby, usually takes up to 9 to 12 months of structured rehabilitation. Again, this is a general rule of thumb and every individual is going to be different. That timeline can feel long, but each phase will build strength, control, and confidence, and doing it properly ultimately reduces the risk of re-injury. Finally, when should you seek medical advice following ACL surgery? Well, please speak to your doctor or physiotherapist if pain or swelling is not improving with rehab and pain relief, you're struggling with movement or the knee feels unstable, your wound becomes red, warm, or has got a smelly or discoloured discharge, you're feeling generally unwell or feverish, or you're unsure if your recovery is on track. Now, there are also times to get more urgent help, and it's really important to seek urgent medical advice right away if you do experience a painful and swollen calf, difficulty breathing, chest pain, fevers and chills, or sudden worsening swelling, redness, or severe pain in the knee that is not controlled with pain relief. These could be potential signs of things like a blood clot or an infection, and it's important to get these assessed quickly. So overall, ACL surgery recovery does take time, patience and commitment, but with good physiotherapy, consistent exercises and following advice from your care team, most people do make an excellent recovery. If you've had ACL surgery or you're preparing for it, please feel free to share your tips or experiences in the comments section. These really do help others going through the same journey. If you did find this video helpful, please consider subscribing to the channel, and thank you for watching.